We really try to look at another test which you can do for hypertension. Okay, when there's high blood pressure, there's a test that you can do, and we'll talk about this test, how it is done, and also reasons why you do this test. So this is angiogram. We call it angiography, which is a test that is done for hypertension. Okay, so what is angiography? Of course, anytime you hear angio, they are talking about blood, kind of like imaging of blood, you know. Okay, imaging for blood. Okay, so just so you know, it's actually a routine test, and they do it for hypertension. Okay, okay, it's not really for hypertension. Do you understand? But they can still do it for hypertension, though. Okay, so they mostly will request for it if they feel like the hypertension is caused by the blood vessel are getting blocked. Do you understand? Mostly blood vessels in the heart, and mostly I'm talking about the coronary artery. Okay, or probably there's an issue in the kidney, so there's like a blocked renal artery. Okay, or any other big blood vessel that I know that there's issues there that is getting blocked. So it's an imaging test that uses X-ray and they'll use contrast dye. So by doing that, they don't do X-ray just like that. They give you contrast. Contrast is a material that will basically enhance the view of these blood vessels. So a catheter is inserted. See, they insert it through what the femoral artery, and I think they will actually pour the contrast there. So the contrast that is injected, and to go up to the level of the heart because every blood has to pass through the heart. So they time it when the contrast is around the heart, they'll take the image. So to dictate if the blood vessel is blocked, narrowed, or there's an aneurysm or any abnormality in the blood arteries. So what's the role of this test in hypertension? It can be able to make you know if the hypertension is primarily. You can be able to know if the hypertension is what? Secondary. Okay, that's like secondary hypertension could be due to renal artery stenosis, coarctation of the aorta, coronary artery disease. So it matters because it's able to identify if a blood vessel has an issue. Do you understand? So you now know whether you have to do any surgery for the blood vessels like angioplasty, stentings, and any other thing. So risk and consideration is there could be bleeding at the catheter site, so you guys should be prepared, and you have to make sure that the patient is not allergic to the contrast dye, you know, and kidney injury from the dye. If the dye is too strong, and probably the patient already has an underlying kidney issue. Okay, so preparation is fasting before test, stop some certain medications that I feel like the contrast dye could actually react with. So this is angiogram test.